Okay, thank you again for the invitation and this opportunity. When I received the invitation, I was trying to come with a topic that is aligned with the conference, but at the same time is meaningful given the times where we are living today with the pandemic and the COVID and all that. So one of the topics that is connected to my research, but at the same time is very hot today, is how AI, image processing, and deep learning is helping in medicine. And when you look at the research per person and any other source of information, you will find how it's an extremely hot topic and many people is publishing around that. And in fact, if you take a look to the scientific publications, not just papers, but conference, etc., you will have the impression of how there is a massive improvement in the amount of space and effort dedicated to this topic. So in this case, what I'm going to try to do, instead of going deeper into one concrete area, I'm going to try to take a holistic approach and try to describe some gaps that we have today, so as we can try to come with different solutions that will help us to evolve faster and make all this progress in reality reach the end customer, which will be in this case the patient. So that's why I came with this title of a holistic approach for AI, image processing, and deep learning in medicine. So this is me. I already had a great introduction by your presenter, so I'm just going to skip this one. So why talking about a holistic approach for AI, image processing, and deep learning in healthcare? Well, basically, the main reason is that there is a lot of work to do in order to match end user expectations and the future that we have all envisioned. What do I mean with this is there have been some predictions that we're going to be talking about, and those predictions and expectations are not matching reality. And we're going to discuss a little bit on that. We will be also checking, or I will be sharing with you what is the reality in Europe on all this progress and why there's a big hype on AI. But also we will try to cover some basic concepts that will help us to understand the challenges. And finally, I'm going to share with you what Europe is trying to do in order to solve those gaps and create bridge that will connect the real patient with the advances and progress that we are doing in AI, applying to medicine and healthcare. So the biggest challenge that we're having today, I would say, is expectations, or at least one of the biggest challenges is expectations. So there has been many predictions around, of course, telemedicine, robots helping us to heal, or robots that are able to take care of ourselves. And we can see that in many science fiction books and movies. But we don't need to necessarily just focus on movies and science fiction. There are many other examples on how there has been predictions that we are not there yet. I'm pretty sure that you all know Thomas Alva Edison. So he predicted that doctors in the future will not give any medicine, but instead just help the patient to prevent any illness. And also all this will be thanks to the technology and the progress. And reality is that we are still not there. Today, medicine is basically trying to help the human body to heal himself. But we are not there in that preventive model where we try to cure before the illness happens. And what is even worse, we don't see that direct connection between the technology progress and how the patients are being taken care of. Of course, there have been many advances, right? It's just that the level of progress that we are expecting and the real progress that is reaching to the patients in many cases is not proportional. So we are going to be analyzing some of the reasons why. So of course there is a massive interest in healthcare on how to use AI, machine learning, deep learning, especially in healthcare sector, is a top priority for 2 of each 3 CIOs. And in addition to that, the market is growing dramatically. So globally, the market for AI in healthcare is calculated that it's around something between 15 to 20% by 2021. Of course, these numbers may be affected by the pandemic and the COVID, but obviously, especially because we are talking about healthcare, the growth will not affect necessarily in a negative way, but maybe in a positive way, as there is a high demand in research and of course everything related to the vaccine. So there is an expected growth, but that's not enough. So the hype is something that we can easily see if we start just doing something very easy, like searching in Google, and you just search for AI. You will see how it's very, very, very connected with medicine, diagnostics, bioinformatics, gene expression, computer vision, image processing, and many others. So there is a clear interest and clear growing number of publications, research regarding to AI, machine learning, and healthcare. We can also see that grow when looking at patent evolution. So there is also a raising production in terms of AI and healthcare. So after seeing all these symptoms, we have to ask ourselves why this is not reaching the patient in many cases. Another point of view that may be interesting or useful to understand why the research is not directly reaching the patients in many cases, maybe is why the companies or the drivers for all this research are not in that many cases universities, hospitals, healthcare institutions. So one interesting data is that in many cases the patents are coming from these companies where they have some interest in healthcare, but they are not public institutions dedicated to healthcare itself. So looking at the patents and publications, we can see how IBM, Microsoft, Samsung, NEC, Fujitsu, etc. are the top of the list. In addition to that, when looking at researchers, they have been also predicting how AI, machine learning, and image processing will change dramatically the way healthcare works in the whole world. And we all know that it is not going that fast. So I have here just 2 mentions of some colleagues from us that they were envisioning how areas like radiology will be dramatically changed just by the image processing and how we can do some diagnostics using image analysis and processing. And some of them were even saying, hey, we should start training radiologists because they should be gone in 5 years. Reality is that I think they were totally shocked by the optimism of assuming that just the reasoning part that is able to analyze image can change the whole system and replace radiologists. But radiologists are doing way more than just the image processing, and that's one of the challenges that we're going to be seeing. So in many cases, the rationing part, the part that can be automated, is just a percentage of what the professional healthcare people are doing. So this is an interesting research that is available for you all in the internet. I encourage you to take a look. It's called Will a Robot Take My Job? And there is a website where you can just put any job, pretty much any job in the world, and you will get some statistics on how potentially a robot or an AI can take that job in the future. And if we take a look to the radiologists, it says that there is only a 20% chance of that to happen. And it will not be immediate. In fact, it will happen during the next 2 decades. So again, we can see how there were some expectations on how fast we can grow, but at the same time, there is a reality on how we cannot go that fast as everybody's predicting. So let's get a little bit deeper on that and understand the why. So clearly we are still not there. While we are still not there, reality is that AI and robotic is growing, but where is growing? So there is a lot of training, there is a lot of research, there is a lot of treatment, investigation, and research. There is a lot of expectation on end-of-life care. There is a lot of AI on decision making, and this is probably one of the areas where we have done more real progress. There is some progress in diagnostic tools, but the problem is that these diagnostic tools are not reaching the market in many cases. There is some potential for early detection, but again, this is not reaching the end patient in many cases. And there's a lot of expectation on keeping well. And this keeping well is interesting because it's one of the areas that is growing very fast, probably because of the Internet of Things and the smart wearables, where we have things like the Apple Watch that is helping us to be healthier in terms of increasing our daily activity and all that. But what is interesting is that it's not coming from the healthcare sector, but it's coming from the private industry. And here I want to pause for a second and highlight some of the words of the director of the India Technology Institute that kindly shared with us at the beginning of the conference, because he was highlighting how in India, but I think this can be applied to the whole world, or many countries in the world, we are creating engineers, but in many cases, we are not being the leaders on creating products, right? And that's what the healthcare sector needs: more products that can reach the end patient and can be used directly. And so in many cases, we are staying just on the research environment, and we are not transition those research to be real products. And that's the challenge that I think in India you will be facing. And of course, we're also facing in Spain and Europe. So some of the areas where research is being more actively used is things like drug discovery. So I think you all know that IT and artificial intelligence has been used in some of the COVID research and treatment. Of course, it's helping in some cases to speed up the diagnostic, but I will say that that's not necessarily artificial intelligence per se. Is more the use of IT, which is being extended, probably not as fast as we would love to, but at least at some speed. Things like the electronic health record is coming very slow, but it's still coming. Electronic surgery, I think, is still more an ambition than a reality. And of course, clinical trials, the technology is helping there. So it's interesting how COVID has helped to accelerate some of the usage of the technology. So this is just one example of how IT and AI have been helping to improve the triaging, reduce the need of call centers and blocking healthcare facilities just because of the number of people trying to use it. So here in Spain, there have been different applications that can be used not just to track people with COVID infection, but also to try to help in order to have a better triage and identify potential cases earlier. So it's interesting how the pressure of the pandemic is helping us to directly apply IT and AI technologies to the healthcare, where in other areas or in other times, just having those technologies being applied will have taken longer. So not everything is bad news. But even with all that, reality is that the big promise of AI and healthcare is still not here. And I'll give you some data and information points, giving the example of Spain. So Spain is supposed to be one of the better healthcare system in the world. So this is a ranking from the Lancet magazine. So we are in the 1, 2, 3, 4, 5, 6, 7 in the 8th position of the best healthcare system in the world, just based on recovery. So basically, the people that is being treated in our healthcare system has an extremely high chance of having a faster recovery than many other countries. So this should be an indication of having a good healthcare system. Or if we take a look from the cost perspective, we also have one of the systems with the highest score in terms of efficiency in the world. So you can see how Spain is the 3rd one in terms of efficiency, which is very good. But even with all that, if we take a look on how the Spanish healthcare system is applying IT and artificial intelligence and technology in general, we can see how we are not mature. So this is a global index of maturity in terms of using IT. And reality is that we are just in an index of 31%, which is, you know, as you can imagine, based on a percentage, 30% is not really good. So we can see how even if we are in one of the best health systems in the world, reality is that IT and technology is still not there, and or at least not as much as it should. And if we take a look to the percentage, in terms of tools for professionals, we are a little bit better because it's 41%, or in terms of availability of IT, it's 42%, or in terms of analytic tool for decision making, it's just 17%. So that's pretty much nothing. And if we take a look to the IT tools that are directly available to patients, it's just around 20%, which is also pretty much nothing. So there is a big gap, again, even if one of the best healthcare systems in the world, that is not connecting research and resources with the patients. So how to solve this gap? How to make sure that we connect the dots and all those amazing research and advances really reach the end patient? So first, I think we need to understand why there is a massive hype on AI, artificial intelligence. So reality is that in today's world, we're constantly talking about deep learning, machine learning, artificial intelligence, but I don't think there is a real understanding for the majority of the population of what we are talking about. So when we are talking about deep learning, in reality, it's just a subset of the artificial neural network that has been there forever, and is really being applied in other sectors, like self-driving, for example. When we are talking about machine learning, it's already been applied in many other areas, like the algorithm that Google is using for Google Maps and similar technologies. And when we're talking about artificial intelligence, is where we have done some progress that are directly connected with the end user, like assistants like Siri or Alexa, etc. But all these applications remains in some areas where the industry has been able to lead and create products that really use them. The other challenge is that we are mixing in some cases the definition of strong AI, when we are meaning about artificial general intelligence, with narrow artificial intelligence, which is where we have done many progress. So when we're talking about a strong artificial intelligence, reality is that we are connecting more with the sci-fi fictions, and reality is that today we only have few examples, and they are relatively poor in terms of efficiency and also real world applications other than being agendas, helping us to find information and so on. When we're talking about machine learning, this is more connected to the areas where there has been a lot of progress on research. And that's why there is part of this confusion. Of course, there are different types of machine learning: supervised learning, unsupervised learning, and reinforced learning. And I want to highlight how supervised learning have been doing a lot of progress, but the future is more connected to unsupervised learning and reinforcement learning. So when we're talking about deep learning, which is one of the technologies that is growing more faster right now, I want to highlight that this is not new. This is just a technology that is coming from the 50s when we were working with artificial neural networks. It's just that now we are going faster. And we are going faster because there has been some progress in other areas that has been enabling the possibility of having neural networks that are more complex and include more layers that can help us to improve the way are being used in classifier systems, especially. So we are going finally faster, and this faster is mainly because of the progress in the hardware area, where the cost of GPUs and ASICs, that is the hardware that is usually intended to be executing and training the neural network, has become more available and extremely more powerful and cheaper. There is another reason why this is going faster than ever, and is the availability of tools. So open source is another player that I think we are forgetting in some cases. So thanks to the availability of open source tools, it means that pretty much anybody have access to the tools that you need to research in those areas and make progress and do some research and new publications regarding to AI, and in this case, healthcare. So as we have the tools and we have the speed and we have the hardware, why we are not having the same progress in healthcare than in finance service, where predictions are around the corner, or governments, or energy, or retail, so manufacturing, or service providers, or even consumer tech? Well, let's go a little bit deeper, and we will see how one of the challenges is that the use cases where healthcare is the target of AI is relatively limited. So we have some examples on disease prediction, diagnosis, detection. Use of local sensors is something that is growing, but we are still not there. The healthcare record is something that is progressing, but again, we should have smart health records, and reality is that in many, many places, this is still being used in just paper. So again, even if I was telling you that Spain is one of the more advanced healthcare system in the world because of the results, reality is that here, many, many hospitals are still tracking the healthcare history of the patients in just paper, which is obviously not what will help us to go faster. Again, in many cases, the clinical workflow are not connected. That's another challenge. There are some areas like fraud detection in healthcare system that is progressing faster. And I have to say that it's maybe just because there is money around there. And that's why fraud detection has been already used by financial institutions, I would say years ago. So it's just a direct translation. So again, why we are still not there? Because there are many progress that has been done. Well, so trying to answer that question finally, I have come with a list of the biggest challenges that we're going to have to solve in order to connect the dots between the AI and artificial intelligence research progress and the end patient. So one of the reasons is technical challenges, but there are many others. So let's try to cover some of them. So when talking about technical challenges, one of the more typical is the data selection. So when talking about healthcare information, reality is that it's not publicly available for a good reason. And that make harder to work with data and trying to find the right data selection and have done the right experiments to go faster. In addition to that, there are real technical challenges regarding to the network architecture, selecting different optimization methods, or having a good domain knowledge. And this is connected with the idea of having multidisciplinary teams. So being able to have our engineers working together with researchers and medical doctors, just in the case of the healthcare. But I would like to highlight here how important is this way of working in a multidisciplinary way, so as our engineers can work with people from many other areas to really connect the technology and the real use cases that will help us to deliver real products. Another interesting challenge is what is called Moravec's paradox, which I'm going to try to simplify, just saying that it's way more easier to have algorithms that work and solve high intellectual problems. Let's take the example of the chess, of the image processing, but it's super hard to have robot or AI dealing with other problems like locomotion, movement, gathering information from multiple sectors, and of course, real interaction with humans. And that's the Moravec paradox that basically explains how we have been having AIs beating chess masters already more than 10 years ago, but we still don't have humans that can replace a nurse taking care of a human being. So reality is that as it is today, we are still the tool and the breaking case of emergency tool that robots will use for every area where robots are still not there. And that's how this may look in the future if we are not able to solve these gaps and reality make sure that artificial intelligence and robots can make that jump and be applied in many other areas. Another challenge is just because the way we're trying to replicate human behavior. So in many cases, the research is trying to just look for parity and look for features that we have as humans and how to replicate those features in the artificial brains. And that parity is just causing an issue in terms of having experiences that are not connected, and that's why they are not a full replacement of the, I would say, human. Let me move to the next one. So of course, there are some areas where we have been able to apply AI in very narrow areas, like some image recognition, some assistance, self-driving. But as you can see, there are areas that are very narrow, very concrete, and that's another challenge. Then, of course, there are legal challenges. So especially in the past, I think we all were extremely concerned of who owns our own information, where is that information stored, and how it can be used. So, of course, we have to find a balance between the legal limitations that are there to protect us, but at the same time, being able to enable the technology to help us. There are some data challenges because information is spread, information is heterogeneous. In many cases, as I was sharing with you before, it's not even digital, it's stored in paper. So that's creating a big gap. Because of this heterogeneous information, the other gap is how to transform that information, extract that information, cleaning that information. And because of the big volumes of data that we need, we have to find ways of doing that in an automatic way, which is another challenge that is still not being fully solved. The patient persona is also another challenge. I would like to ask you, how many of you are still just filling a questionnaire when you're going to the doctor? So every single time that I go to a doctor, I have to fill a survey, some questionnaire. The doctor will be taking clinic notes that are supposed to be confidential, but all that information is not necessarily connected. And every single time that I go to a doctor, I have to answer the same question, which is obviously a clear symptom of not having a good information and data management policy globally. Some good news is that there are newer data sources that are a little bit better because are more digital. So we are having external devices, more wearable, more home devices, even social media that is being used to detect illness, and is information that is being used to create a digital profile of each of us that hopefully will help us to improve the way AI and healthcare based on artificial intelligence and robotics reach us as patients. The other challenge, and is very connected with everything that we have been discussing, is interoperability. So if you are asking yourself how you can help to solve this problem and how you should look at areas where you can make a difference in healthcare, it will be interoperability. So there is a big need of trying to figure out how to make the system interoperable so that we can have that end situation where we can really help the end patient having a global vision on how it is, his information, his data, his symptoms, and trying to use all that for the benefit of the patient. Another challenge is fear. So this is an interesting view that you can also access online. This is showing all the public manifest or strikes against data usage. And in many cases, it's directly connected with the usage of healthcare information. So we have to put also a lot of effort on create awareness on the people and the population on how the information is extremely helpful, and AI is here and is here to help. So what is Europe trying to do in order to solve this gap? So one of the goals for the next 10 years for the European Union is trying to make sure that digital healthcare is more available to citizens. So it's exactly the gap that I was describing, the gap that has been identified in Europe as a potential issue. So what Europe is trying to do is first create more awareness on people. So as it is today, 90% of the citizens agree that they want to have access to their own health data that until now was not directly available for the patients, and it was just under control of the hospitals and doctors. Also, 80% of the people is already in agree that they are okay to share the health data as far as is for helping them to have better care and better results. And finally, 80% of the population is also on agree on providing feedback on the quality of the treatment, which is also good because if we cannot provide feedback, reality is that it's really hard to get the system better. So what is really doing Europe in order to solve the gap? Well, apart from creating that awareness, Europe is now starting to invest more than 400 million allocated just for research, but research that is connected to create real product that will be available and connected for the patients. Instead of just focus on pure research, they want to make sure that research is applied directly to things that are available to the citizens and to the end patient. So I think that's the gap that we need to solve. Europe is following this route of trying to invest, but I think this is something that we should also do as researchers, try to focus on research that can be directly applied to the real world patients and not just stay on magazines and research papers. The way this is being tracked is first focus on applications that can secure and access healthcare data, also on having access for the healthcare data directly to the patients, and also having interoperability between the different actors in the healthcare system. That means individual doctors, but also different hospitals. It also means international authorities, and so on and so forth. And with this, I just want to share a final comment. I think there is a big opportunity here for we all to make those artificial intelligence advances, research, and progress more available to the patients. And this is not just from the research perspective, but also from the product perspective that will help you to come with products that hopefully will have a big impact in the market and also in the benefit of the patients and the healthcare globally. Thank you very much.